Across the land, sleep comes. But for some, there is no rest. As a nighttime symphony begins. You wouldn't know to look at her, but Agatha Appleton was a champion snorer.
Oh, I was always embarrassed about it. Always.
Snoring that was so severe it left her exhausted, even after a full night's sleep.
I would always want to sleep. That was all that was on my mind. Sleep, sleep, sleep.
Her snoring caused her to stop breathing, as you can hear in this video from a sleep lab study. Then she would waken gasping for air. It's called sleep apnea, and it worried her husband, Jim.
She would actually gag, choke, like somebody was choking her at night, and it would wake her up. She would jump up out of her sleep, and I would have to ask her if she was okay.
Doctors found that Agatha stopped breathing 89 times an hour. As a result, her brain was deprived of oxygen, her body dangerously tired.
I would be driving, and I would, like, literally, my head would gnaw away. If I was at a stoplight, I could fall asleep. It was getting that bad.
By some estimates, almost half of the adult Canadian population snores, and about 10% of those also have sleep apnea, making it a big problem, because it can be hazardous to your health. Those with apnea are at a higher risk of having heart attacks and strokes, and of being in car accidents.
Never ceases to amaze me that people are alive at the end of the night, or that they don't die from oxygen deprivation.
Dr. Victor Hofstein is a leading sleep researcher at St. Michael's Hospital in Toronto.
Because their oxygen drops to levels that are incompatible with life, but it doesn't stay a long time at those levels. And that is why, perhaps, people get through the night as well as they do.
When people snore, the tissue at the back of the throat, the uvula and soft palate, vibrate. In apnea patients, the tissue's so loose it actually collapses in the throat, blocking oxygen flow. Not only is it tough on the body, apnea can put a strain on the strongest of marriages.
If you have a good hot rod engine that really rumbles, that's exactly what he sounded like.
Robert and Marianne Haas have been married 34 years, all of which Robert snored.
I would get angry, yes, because I couldn't get to sleep, and that would make me angry, and I knew it was unreasonable.
She was up many nights poking Robert awake when he stopped breathing, something his doctor found he did 36 times an hour.
You die 36 times an hour with this sleep apnea.
Over the years, people have tried a number of gimmicks, including nasal devices and even electric monitors, usually with minimal effect. Surgery has become another popular option. Doctors remove some of the excess tissue at the back of the throat. While it works with snorers, surgery does not work well for apnea.
I guess these are finally dry.
No need to tell that to Mary McPhee. She too snored and had apnea and tried laser surgery hoping for a cure.
I was really disappointed.
How much did you spend?
$1,200.
And the surgery didn't work?
And it didn't work.
In fact, more than half of the patients who have surgery end up with the same sleeping problems. Then there's this treatment, a machine known as CPAP, short for continuous positive airway pressure.
It's a vacuum cleaner in reverse, right? Instead of sucking air, it blows air, and it basically just splints the back of the throat open.
And it works in most snoring and apnea patients, but half don't continue using it. Not everyone, it seems, wants to sound like Darth Vader every night.
It's broken up more than one marriage. Snoring. It's loud, it's annoying, it's unhealthy. Next, Extra shows you the remarkable device that can stop the noise and bring peace back to the bedroom.
Many of you may know this. It's the sound that can break up happy marriages. I'm talking about snoring.
Once upon a time, surgery or drugs were perhaps the only proven ways to solve the annoying sleep disorder. But our Phil Schumann has discovered a new breakthrough for a silent night.
The sound of peaceful sleep. Shh. A silence like no other. A few minutes later, listen to this very same man. Doctors say he suffers from obstructive sleep apnea, a disorder that causes snoring. And it's a common problem that caused mayhem in the marriage of Earl and Jackie Nine.
Who wants to be intimate with your husband when you're so darn ticked off at him?
When someone sleeps with their mouth open, the tongue falls back slightly, obstructing the airway. That can cause snoring. But now, dentists like Manhattan's Dr. Michael Gelb are bringing relief to those noisy nappers. He's fitting his snoring patients with the appropriately named device, the Silencer. It was invented by Dr. Wayne Halstrom of the Vancouver Sleep Center. The custom-molded silencer pushes the lower jaw forward. That forces the tongue to lie flat and allows a clear airway as you sleep. The silencer's greatest success story, however, may be Mark Hebert. He made it into the Guinness Book of World Records as, you guessed it, the world's loudest snorer.
I could not believe the results. It was like a new life given to me.
Now, let's talk about snoring. Not only is it annoying to those around you, snoring can actually be the first symptom of a more serious health problem. Dr. Jocelyn Eplon is here to explain the cause and the treatment.
And the treatment, exactly. It's called sleep apnea. And according to the National Sleep Commission, 40,000 people die each year in their sleep as a result of it. But there are a few different ways to prevent it and treat it. 40 million Americans suffer from sleep disorders. Mark Diamond is one of them.
I've been snoring for a long time, and it's been to the point where I've actually waken up in the middle of the night, short of breath and actually choking.
Recently, Mark was diagnosed with sleep apnea. Sleep apnea occurs when breathing periodically stops for at least 10 seconds during sleep. This can happen at least 10 times an hour. It's caused by the muscles of the soft palate at the base of the tongue and the uvula. The tissues relax and sag, completely obstructing the airway.
You never get a good night's sleep. You're always waking up or getting woken up because you snore too loud.
Aside from snoring, other symptoms of sleep apnea include waking up tired, even after a full night's sleep, waking up with a headache, falling asleep at inappropriate times, irritability, short temper, problems with concentration or memory.
Folks suffering from apnea do not get down into their sleep cycle deep enough to get the restorative, regenerative sleep that they need.
People who are more at risk for sleep apnea include men, people who are overweight, and those over 40. Treatment for sleep apnea includes surgery to correct physical abnormalities, laser-assisted surgery, and CPAP, an air pressure device used during sleep. And an oral device called the Silencer is also being used to treat the problem.
It very easily moves the lower jaw forward, and in so doing, it pulls the tongue out of the airway because the tongue is attached to the lower jaw.
Can the Silencer work for everyone?
If you're missing a lot of teeth, there's another appliance that might be more suitable for you, but it really requires a medical and a dental examination.
Mark Diamond found relief.
I'm not as tired in the morning. Seems like I'm getting more sleep. And my wife is telling me she doesn't hear me as much.
Now, sleep apnea has also been associated with high blood pressure, cardiac arrhythmias, excessive daytime sleepiness, and even personality changes.
Snoring for many Americans sleeping couldn't be any noisier. It is a problem that can be heard in bedrooms nationwide if you are so inclined to listen. Now a Canadian dentist has come up with a device designed to muffle the problem. Karen Hasby has more on what's known as the Silencer in tonight's Health Watch.
It's a nightly ritual in millions of American homes. Couples snuggle down to sleep until Joel Ontel knows what it's like.
My wife poking me and prodding me throughout the night, waking me up, telling me to stop snoring, and eventually getting to the point where she can't sleep and she has to get up and leave the room and go into another room to sleep.
So today, Joel has come to this hotel in Queens. He'll be the guinea pig as dentists from around the country learn to use a device called the Silencer. Developed by a Canadian dentist, the Silencer is designed to attack snoring at its source. In some, but not all cases, the tongue and soft tissue at the back of the throat, called the soft palate, slide backward during sleep. Air vibrating through a partially closed airway causes snoring. If the air passage closes entirely, that's sleep apnea, which can be a killer.
What we're doing is, by moving the jaw forward, we're pulling the tongue out of the airway. It's a very physical thing. If it's comparable to moving a tractor with a trailer with a tractor.
Once the mold is complete, the Silencer keeps the lower jaw thrust in front of the upper one for 8 hours every night, with a tiny hinge allowing a minute amount of movement side to side and front to back. You'd think it would hurt, but the dentists who sell it say no.
We make the patient a very comfortable bite to begin with and move very slowly and incrementally in small steps forward to advance the lower jaw. And by doing so, the muscles get accommodated to it and the joints get accommodated to it, and we don't cause any long-term bite changes.
You are watching Fox 11 KTTV Los Angeles. Welcome to Good Day LA. I'm Steve Edwards. Here's what's making news on this Wednesday, May the 21st. And is snoring ruining your, look at this poor guy, ruining your relationship? Well, there is a brand new device that can solve the problem forever. We'll show it to you this morning, coming up right here on Good Day LA.
Live from the Fox Television Center, this is Good Day LA.
Good morning, Tony.
Good morning, Steve. How are you?
Good. Did you sleep well?
Are you going to explain what this is all about, or are you just going to let me surprise the audience?
You know, we've been saying that we're going to bring up something that is very damaging to relationships and causes problems in bed.
It can even cause divorce. It has been known to.
Not you. And that's why you're here? Not Tony.
Listen, has the Sandman been skipping your house? Are you or your loved ones noisy nappers? Well, a new device is now helping millions of chronic snorers slip into a sound sleep. Don't miss this report because, as they say, if you snooze, you lose. About 2 out of 10 of us spend our nights like this. But snoring is not an exclusively male problem.
I have been snoring since I was 19 or 20, and it's gotten progressively worse to where my husband sometimes can't stand to be next to me in bed.
51-year-old James Buckman has been dealing with a severe snoring problem for the past 8 years. Not only does he go to work feeling tired, he says it even led to the breakup of his marriage.
It was certainly something that I think pushed my marriage over the edge. The wife had complained about me snoring on an ongoing basis, and I kind of ignored it. I didn't know it was a big problem.
But it was such a big problem that he eventually had surgery. His uvula was even removed, but the problem got worse. So today, Buckman is being fitted with a special appliance called the silencer. Snoring occurs because when some people sleep on their backs, their tongues partially obstruct the airway. In fact, if the problem gets bad enough, victims can suffer from obstructed sleep apnea, where they actually stop breathing for up to 350 times a night. The silencer is a custom-made retainer that fits over your teeth to pull the jaw forward, opening the airway.
It represents probably the most exciting thing that's happened in dentistry and medicine, really, for that matter, specifically to sleep disorders.
In fact, doctors say more than 90% of those who can wear the device report their snoring has stopped. Stephanie Lampert has been using the appliance about 4 months now. She saw results the very first night.
Well, I haven't had a good night's rest for 20 years, so it feels wonderful. It feels refreshing. You get up in the morning and nothing hurts.
Because the device is hinged, it provides a more effective and comfortable fit. The only other device, short of surgery for some, is this respiratory type device, which some find uncomfortable. As for Buckman,
it's become quite a major problem and issue in my life that I want to get fixed, and I'm under the belief and impression that this item, this device, the snoring device, may help.
From the Fox Television Center, this is Good Day LA.
Tony is back with a follow-up on that story about the cure for snoring.
Yeah, you know, 2 out of 10 of us do this every night.
Cry? No.
Snoring. But snoring is sometimes more than just a pain in the ear or another part of your anatomy. It can also be a health risk. Weeks ago, we told you about a patient being fitted with a device that promised relief and more than a few Z's. Did it work? Well, take a look. By his own admission, Jim Buckman's snoring was nearly enough to rattle the Richter scale, a snore so powerful it kept everyone in his house awake at night and eventually helped to end his first marriage.
I ended up divorcing from that wife. I wouldn't say that it was a major part of it, but it certainly had something to do with it.
Jim even underwent major surgery to suppress his snore, having his uvula and tonsils removed. The operation made swallowing harder, but left his snore intact and louder than ever.
Were you frustrated? Very, very frustrating. Frustrated and angry. The expense, the pain, all the discomfort, all the things that go along with it.
When we first met Jim back in May, he was being fitted with a special device called the silencer, a custom-made retainer that fits over the teeth, pulling the jaw forward. That opens the blocked airway in the throat, which causes the problem.
Hey, Mr. Buckley. How you doing?
Jim's been wearing the device for about a month now and reports his snoring has decreased a whopping 90%.
It's great. It's tremendously better than it was.
Mr. Buckman was probably the hardest patient that we could have chosen to do this on, and his result is fantastic.
Doctors will now try to get rid of that last bit of snoring by adjusting his retainer in a way that will open his airway even more.
I would hope that it would eliminate it, but I wouldn't want to say that it will eliminate it. I can't tell you how excited I am that he got what he got.
That's it. Thank you. For years, I don't remember having any dreams, but lately I've been having quite a few and remembering some of them, so I kind of wake up in the morning and say, wow, I had a dream last night.
Pete Philbrick drives a truck, has for 30 years. He, too, has never made a mistake, but he knows what can happen.
I haven't seen the figures on that, but I would think that fatigue would play a pretty big role in almost any accident.
The figures suggest truck driver fatigue contributes to 30 to 40% of all heavy truck accidents.
I saw the results of the study that the National Highway Safety Agency did, and they said that as near as they could, I guess the drivers that they had wired up didn't realize that they were tired enough to fall asleep.
Dr. David Dingus, Ph.D., studies sleep at the University of Pennsylvania.
Almost every study that's been done looking at the timing of crashes across the day indicates, at least those associated with fall asleep crashes, indicates huge peaks in the middle of the night, smaller peak in the middle of the afternoon. And so it's clear that the same biological forces that regulate brain function are contributing to fall asleep crashes on the roadway. It's also true that anecdotally, some of the more serious industrial catastrophes, from the uncontrolled swim at 3 Mile Island to the grounding of the Exxon Valdez, occurred on the night shift and involved some sort of a human error.
I remember one thing only, which is it's like just that 1 second before impact, I can actually see the other driver's face. The cars are head to head. They're about to make impact.
What happened to Frank Salvaggio?
That was a very tragic incident.
Dr. Charles Seisler testified at Salvaggio's vehicular homicide trial.
He said that all he remembers is suddenly he woke up and he was staring at the woman in the other car that was oncoming, and he couldn't seem to drive out of the way. And he saw this inevitable collision that was flashing before his eyes.
It was Sunday, 4:30 in the afternoon, one of those peak times the body prefers to shut down. Part of Frank Salvaggio's brain apparently shut down, fell asleep. Another part of him continued driving into disaster. It's called automatic behavior syndrome, a contributing factor in plane, train, and car crashes.
I would say right now the social consciousness of this country on the issue of sleepiness and driving is the same place that it was 30 years ago for drinking and driving. At that time, people thought, if I can hold my liquor, I'm tough, I can drink and I can get in the car and drive. And then the Mothers Against Drunk Driving and a whole variety of movements came out and really said that that's irresponsible. And drowsy driving needs to be categorized in that same way because it's just as dangerous.
We're going to continue without sleep, without rest, to save America, to save America.
If we've learned anything about sleep leadership since the campaigns of '92 and '96, it's that America needs a good night's sleep. Lou Waters, CNN reporting.
Dickens described it in the Pickwick Papers.
The snoring of the fat boy penetrated in a low, monotonous sound from the kitchen.
It's been the butt of many a joke in movies, such as Planes, Trains, and Automobiles. And in Black Sheep. But snoring isn't fiction and it isn't a joke. It happens when a person's throat muscles relax during sleep and the person tries to breathe through an opening in the back of the throat that's too small. This causes the soft palate to vibrate and make that noise we all know so well.
Snoring has a huge spectrum, and I think that's the key variable you need to keep in mind. Some people, it's just making noise. It may upset their spouse or the guy next door, but it has very little clinical impact. In other people, it indicates that they're dramatically working to breathe. It indicates they have sleep apnea.
Frank Tosti knows about the serious consequences of sleep apnea.
It's scary as hell when it happens to you.
Tosti snored for 40 years before his condition worsened and he developed apnea, where you literally stop breathing in your sleep. The sleeping disorder caused him to doze off during the day, sometimes in the middle of a conversation or at work, and on 2 occasions in the car.
3 of our grandchildren in the back seat. They were singing and the radio was blasting, and he again went off the road. He said he was all right. I was going to drive, but he said, "Oh, I'm fine, I'm fine." Next day, I called the doctor. I called his primary care.
We know that sleep restores the immune system, has even been given credit for slowing down the aging process related to the quality of that sleep. Is primary care aware of this and treating their patients?
Well, I'm glad you asked that, because I was visiting a primary care center just a week ago, and 3 doctors were taking care of 6,000 patients. Ooh. And not a single sleep diagnosis. And when I was sort of trying to recruit them, I realized that I was scaring them. They were saying, "We don't know anything about this. You mean to tell us that we may have 1,000 patients who need something that we don't know how to deliver?" And it's kind of a crisis.
Ever been surprised when someone tells you that you snore? Pretty embarrassing. But for some people, it's more than just an embarrassment. Snoring can make life miserable for them and for their loved ones. There are some new remedies out there. Of course, the question is, do they work?
1 in 5 people snores. And the bad news is it gets worse as we get older. Half of all those over 60 are snorers.
So the typical person who snores is male, usually somewhat overweight, usually around middle age.
Dr. Jeffrey Lipsitz runs a sleep disorder clinic in Toronto.
They have a big shirt size, a big collar size. That's been suggested as being one tip-off that the person may be at risk for snoring and the related medical disorders.
If your partner's snoring is a real problem, you may be tempted to buy some of the many gadgets out there.
But nothing worked for me.
Mark Hebert of Vancouver tried desperately to stop snoring. He holds the distinction of being in the Guinness Book of World Records for the loudest snoring, 90 decibels.
70 decibels is a vacuum cleaner. 80 decibels is your average city traffic noise. And 9 decibels is equivalent to a lawnmower. So imagine that noise blowing in your ear for 20 years, you know?
In Hebert's case, the ear belonged to his wife, Carol.
It kept on roaring, 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 like a motorcycle revving up.
Hebert's snoring was so loud, it got him on the Johnny Carson show in 1989.
Listen to
That sounds like the approach to LA Airport.
Hebert tried everything to stop snoring, like this anti-snoring pillow designed to keep you sleeping on your side. But that didn't work.
So then we tried this little nose piece. And what you do is you fold it in half and stick it up your nose.
Did that do anything for you?
That did absolutely nothing.
Then Hebert took the medical route. He underwent surgery to sever his uvula.
That's where they chop off that little punching bag that hangs down in the bottom of your throat.
The problem is that procedure works only in a limited number of cases, and Hebert wasn't one of the lucky ones. So is there anything that does work for most people? Well, sleep disorder doctors point to a couple of medical devices. The strange contraption this woman is struggling to put on is called CPAP. That stands for Continuous Positive Airway Pressure.
Colleagues of mine have described it as a vacuum cleaner in reverse. Instead of sucking air out, it just blows air in. It really just takes regular room air, filters it, and blows it out again through the tubing and into the mask. When the air comes through the mask and into the upper airway passages, it keeps the airway open so that the airway collapse and the airway obstruction never occurs again, so long as the mask is being used.
The CPAP machine, which must be worn nightly, costs $1,600. Dr. Wayne Halstrom is a dentist in Vancouver who's made snoring and sleep apnea his life interest.
People who are chronically sleep deprived as a result of obstructive sleep apnea will be people who will fall asleep at the dinner table, can't stay awake in front of the television, can't go to a movie and stay awake during it, and will have this tendency to nod off when they're driving their automobile.
Dr. Halstrom himself had both a snoring problem and sleep apnea, and it almost killed him.
I had 3 worsening car accidents until in 1989 I hit a freeway abutment at 60 miles an hour.
Dr. Halstrom developed this dental device. It's called The Silencer, and it's had considerable success in stopping snoring and in reducing mild cases of sleep apnea.
It completely eliminated the snoring. It stopped my sleep apnea.
The Silencer solved Mark Hebert's severe snoring problem, but for Carol and Mark Hebert, the solution came too late. After nearly 2 decades of marriage, they're now divorced.
After that constant snoring in my ear, I guess I ended up so that I began to begrudge him, for, ruining my sleep.
All I want to suggest is to your audience that if there is a problem like we have, address it now and seek the medical attention before you wind up like us.